Whew. Hello, hello, hello. Yes. Good evening, everybody. As we log on, I'll turn the volume up a little bit. And Kiera Hardy, what are you doing? Where you been, girl? Take care of yourself. You know how you are. Good evening. Good evening. Good evening. We are getting ready to talk a little bit. Talk about it Tuesday. It's 9 o'clock. A little flustered today because I've been running around all day long. Hey, Jazz. How's it going? What we talk about today, this evening, I'll talk about it Tuesday, is, what is this? It's a potato. Like, what does this got to do with anything? Why does she have a potato in her hand? What could a potato possibly have to do with women's health? I'll tell you in a minute. We're going to wait for the live to pull up a few people. Y'all probably over there watching 45 talk about whatever he's talking about. I don't even know if he's on yet, but I promise you I'm probably a lot more entertaining than him because, well, you know, he's doing whatever he's doing, trying not to get impeached in 2020. So happy Tuesday, everybody. Thanks for logging on as people are starting to join us. And we talking about, yeah, we're going to skip him. I've been running around a little bit today. So I'm a little like, had to get in the house and get on live right quick. And so my promo girl was like, what are you going to talk about? I was like, I don't know what I'm talking about. But then I had like 4 people come in today. Shout out to one of my clients. She knows me from Facebook, actually, and she flew down from New York to see me for a second opinion. I was so honored and humbled. I was like, wow, you came all the way? She was like, yeah, I feel like we know each other. So that was super exciting. We had a good visit. But what we came to talk about today was, drum roll, something a lot of women, especially women of color, deal with every day. Some of you have already had uteruses taken out for this very, very reason. And one of the things that is fibroids, right? Fibroids, Fibroids. And that's why I was holding up earlier this potato, because when you take a fibroid out, they kind of look like potatoes, for lack of a better word, a peeled potato of all different sizes and shapes. And so fibroids look very much like this when you see them, when you take them out of someone's body. And that's what we're going to be talking about today. So just a little talk about fibroids. One, we know fibroids are non-cancerous. Now, let me say this. These are fibroids. They are in the uterus, down where the baby hangs out, not to be confused with your thyroid, which is a gland in your throat, or fibrocystic breasts, which is a different pathology in the breast. A lot of ladies tell me they have fibroids in their breasts. I'm like, not quite that. It's not quite fibroids in your breast. Fibroids are in your uterus. They can grow in the walls of, on top of, all around the uterus. And the main thing that we know with fibroids is that they can cause some really heavy bleeding. That's one of the main things that fibroids are known for, is heavy bleeding. We know that they are tend to be hereditary. They tend to run in families. They tend to have sisters and cousins and whatever, mothers. If your mom had fibroids, you may be more likely to have fibroids. But the exact cause of why they form and why they grow the way they do is unknown. Now, fibroids are benign, which means they're not cancerous, and they're not going to become cancer. People who have fibroids, they don't start off one way and end up another way. They are benign. They don't turn into cancer. They don't become cancer, but they can be very very annoying, and actually they are the number one cause nationwide of hysterectomy. The number one diagnosis that people get hysterectomies for is for fibroids, and they have the consistency of kind of like a raw cut potato, just a little bit squishy, kind of mealy feeling. So if you have fibroids taken out, you will know what they feel like. This is kind of what they feel like, is a squishy raw potato. Now, there are over 200,000 cases of fibroids diagnosed every single year in this country. 200,000. That's a lot of fibroids. And they can grow in size. They can be very small, like marble size. They can grow as big as a cantaloupe. I think the largest fibroid that I took out, I just took it out maybe a couple years or two ago, weighed about 6 pounds. It was one big giant fibroid, and it weighed about 6 pounds. And I was able to take it out and still not take out the whole uterus, but they can grow very, very large. You can have a small one or many small ones, or you can have large ones. They vary greatly in size and range. And it really just depends on the individual. Some people have one very large one, and that's all they have. And once that's removed, then they tend to be fine. The cause of them is not very well understood. Why some women get them and some women don't. Why some grow very large and some kind of stay the same. They just don't know. What we do know is that they tend to be fed by excess estrogen in the body. So obesity, because obese women tend to make more estrogen. Obesity, women who are obese tend to have a bit more problems with fibroids, and also women who consume a high fat diet, high in animal fat, will tend to have more fibroids. But again, kind of no rhyme or reason for it, and no rhyme or reason as to why some grow and some don't. So a lot of women come in, they're usually found either on examination by your gynecologist, or on ultrasound. You can see fibroids. And again, sometimes they grow and get bigger, sometimes they just kind of stay the same. But a lot of it depends on the symptoms of the fibroids. The main symptom, or the main thing that could alert you to the presence of fibroids, is that you would have really heavy periods, heavy bleeding with your periods, or just bleeding in between periods, right? So we all know that a normal menstrual cycle is supposed to last anywhere from about 3 to 6 days, maybe 7. And usually the first couple of days are a little heavier, and other days tend to be a little bit lighter. So when we say heavy, you mean like changing a pad probably like every hour. Sometimes some women actually do bleed that badly, where they can't hardly leave the house before they go from here to here, and they're soaking through a pad. They go to here, and they're soaking through another pad, and pushing out the tampon or whatever, because they are bleeding so heavily from the fibroids. Another major issue with fibroids is because they're solid and they're bulky, is you can have a lot of frequent urination. And some women even will have accidents on themselves because the fibroids are pushing on the uterus, on the bladder that hard. And as they grow, obviously the belly protrudes, where some women even get to the point where they look like they're pregnant. 4 or 5, 6 months pregnant. I had a patient come in once who looked like she was 8 months pregnant, and it was that her uterus was just so big with fibroids, and she was afraid to do anything about it. So they can grow very large. Now, obviously, the larger they get, the heavier the bleeding tends to be, right? And so we see a lot of issues with women being very anemic when their iron drops low, because they're just bleeding all the time, and their iron is dropping slowly, but still dropping down to levels that require blood transfusions and so forth and so on. And that's a horrible feeling. They feel weak, they feel fatigued, and a lot of times the main cause is the fibroids. Another issue is obviously pain. Sometimes abdominal pain, sometimes back pain, because if the uterus tilts more toward the back than the stomach, some women are tilted that way, they'll have a lot more back pain than they'll have abdominal pain, and you take the fibroids out and you fix the back pain, right? Another issue is constipation. Women who tend to have fibroids, because the fibroids, again, are solid, and the bowel is more, spongy and thin, kind of like, chitlins, that kind of texture. But human bowel is the same way. It pushes on the bowel, and it pushes it, and it compresses it, and then you don't, the bowels aren't able to move through like they're supposed to because of the presence of the fibroid, right? So when these things start to happen, some women, we tend to ignore fibroids a lot. We tend to just go, oh, it's this, or oh, my periods are a little heavy. And so when I have patients come in, I really try to get to the meat of how bad are they. And I've even had ladies who tell me they buy Depends and wear Depends once a month because that's how bad they're bleeding. I'm like, wait, that's way too heavy. And then as we dissect it, they're having really heavy periods. They can't necessarily go out or can't do what they need to do. And a lot of that is because they have these really significant fibroids that are causing all of these issues, right? So then we have to talk about what can we do to help and what can we do to fix the fibroids, because, well, you can't just live and be bleeding like you're going to just die every month. It's just terrible. You got to fix the fibroid, right? So one of the things that we can do is, a lot of it depends on the size, and a lot of it depends on how many, hey Molly, the size and how many fibroids there actually are. So when fibroids are smaller, depending on where they are, and again, they could be they could be within the wall of the uterus or kind of on the outside. And sure, as Allison said, you can just take them out. However, for sometimes with women who are wanting to have children in the future, they're not ready to get everything kind of taken out. And so we have other alternatives we try to work with them with. We try to, because they can also cause issues with infertility. Not always do fibroids cause infertility, but they can, and they can make implantation of the placenta for the baby difficult. They can make labor and delivery difficult. And if the fibroids are down low toward the bottom where the cervix is, they can even block the cervix so the baby's head can't come out vaginally because the fibroid is blocking the cervix. So all those things happen, but they can they can have regular healthy pregnancies. Shamaya says she's okay with them knowing our motility pound. It was 5.5 pounds. On Facebook, one of my patients is saying that she's okay letting people know that I removed it, and I did and removed a big old, about 5.5, 6 pound fibroid from her uterus. It was huge. I have pictures, but it's on my phone. So anyway, so they can be troublesome, and they can be a problem when it comes to trying to have children and you're trying to procreate, right? So you have to kind of get them treated. And there's a lot of, they're small. You can try doing things like birth control pills. You can try doing things where you help to kind of decrease the blood supply to the uterus. And that can help in some instances. You can even do like an IUD. And again, if the fibroids are small, then sometimes that can usually work. However, if the fibroids are large, and I say large, like I showed you on my potato, this potato is probably, let me see, we would call it like a four centimeter fibroid. It's about this size. You can have multiples of these in the uterus. You can have smaller ones that are like pea size. You can have really great big giant ones. So for ones that are like this and larger, like 4 centimeters and larger, birth control pills tend not to work as well for bleeding, for control of bleeding. You kind of need to do something more drastic, right? So let's just talk about some of the things you can do for the fibroids. We all know there's hysterectomies, and people say the uterus must be destroyed, but everybody doesn't, believe it or not, doesn't all want a hysterectomy. Sometimes people just want to preserve their uterine functioning. There's a lot of advertisements and stuff you hear about UFE, or what they call uterine fibroid embolization. And what that does is that it starves the fibroid by blocking the blood supply that goes to the uterus, right? So they work to shrink the fibroids to a degree. The UFE will not get rid of the fibroids. They will get them a little bit smaller. I think the averages are somewhere between 15 to 25% smaller. So if I'm 15% or 25% smaller in this potato, this is 4 centimeters, I might get down to like a 3 centimeter fibroid when I'm done. However, the fibroid will not be gone. Usually the bleeding will be better because there'll be less blood supply going to the uterus, and larger fibroids again will be a little smaller, but they won't be disappeared. I've had, I think when they first started promoting that as a treatment option, women were thinking they would get this treatment done and the fibroids would just be gone, and they'd be like, there's no more fibroids. And then they'd be like, why does my stomach still feel really full? And why does my stomach still feel chunky and all that? And I'd be like, well, because your fibroids are still there. And they'd be like, what? I thought they were going to be gone. And they're just not going to be gone, because they're only going to reduce it by a certain amount of a certain size, right? So the other thing that you would need to do is have them physically removed. And that is obviously a surgery. You can do one of two things. You could do a myomectomy or a hysterectomy. So a myomectomy is like, again, opening up, going in, opening the uterus and popping the fibroids out. And fibroids kind of remind me of like, you ever shelled peas and you pop the thing and the peas pop out? But when the fibroid has a capsule around it and you kind of incise it and kind of pop the fibroids out, and you kind of pop them out, and then you can kind of set them to the side. So you can take out, you can take fibroids out all day. I've taken as many as 20 out at one time in one patient. There were just multiple different sizes, and we just kind of went in and shelled them out because she still wanted to preserve her uterus. And so in that case, you just take the fibroids out. Now, typically, they don't come back once they're out. They may come back. If there were some small ones that didn't get removed, they may grow with this additional space, but in general, they don't usually come back once they've been physically removed with some kind of surgery. And that can either be a surgery where you make an incision, kind of like a C-section, or sometimes you can do it with a laparoscope, going in through the belly button and kind of seeing it that way. That's a little bit more, that takes a tighter skill level, and you have to make sure that the people that are doing that, if that's your option, know what they're doing. Usually, because you can get into a lot of bleeding and stuff when you're doing laparoscopically and have a hard time controlling it. Okay, and the fibroids, sometimes they can be in the actual center of the uterus, in which case you have to kind of pop it open and pull it out that way. Now, if you're planning on having children in the future, and you have what they call a myomectomy, you may need to have a C-section for any future deliveries because the wall of the uterus may have some of its integrity a little bit compromised because you've had to cut it open to get the fibroids out. And then, of course, finally, there's what they call the hysterectomy, which is taking the uterus out. So let me pause right here. I promise you I have this discussion every single day with patients. A hysterectomy is taking out the uterus, period, right? Now, people will say they had a partial hysterectomy or a total hysterectomy. A hysterectomy, and I wish I had my visual aids, but I don't. A hysterectomy is simply taking out the uterus, the part where the baby is. When you take the uterus out, it's a hysterectomy. In medical terms, there's no such thing as a partial hysterectomy or a total hysterectomy. No such thing in medical terms. That's more of a layman's term. And a lot of people refer to the total hysterectomy as having the uterus taken out and the ovaries. That's really not what it is. But if you had just the uterus, you still had a total hysterectomy. You didn't have what they call a BSO, which is a bilateral oophorectomy, which is taking out the physical ovaries. And because the ovaries and the uterus are not technically attached to one another, it's two separate procedures. So just to kind of, and I'm just saying that because everybody says, oh, I had a total, I had a partial, And really there's no such thing as a partial hysterectomy. It is or it isn't. But everybody kind of just says that because, well, that's what we say or what people say. So and that's fine. But understanding that taking the uterus out in any form is doing a hysterectomy, and removing the fibroids are usually within that within the uterus is more is a total hysterectomy, and the fibroids are included. So it's not like the fibroids out and the uterus is one big thing and you take it all out, right? So let's talk about some of the other more rare but interesting issues with fibroids and not treating them. I have a lot of ladies who I've seen over the years who were just like really afraid to get stuff done. They're afraid of the surgery. They're afraid of all the things, and they really can cause some long-term effects as they continue to grow. Now, as I said when I first started, fibroids don't turn into cancer. They don't start off benign and turn into something else. But if they do get very large, they can really cause some problems with your digestion, with even your blood flow. I had a lady some years ago who ended up getting a blood clot in her leg because the uterus was pressing so hard on the vessels that it caused the blood to clot. Isn't that strange? And it was really just because of the fibroids that were in there. And so once we got her, it was a whole big shebang about her coagulation, all this other stuff. But once we got her in there, we were able to take the uterus out and we kind of fixed her blood clots. Kind of weird. And just a word about some other treatments that you may have heard. Now, there's a medicine called Lupron. Lupron is an injection that you can get to treat fibroids, okay? It will cause the fibroids to shrink and decrease the blood supply. But Lupron is only to be used temporarily. I have seen ladies come in, they've been on Lupron for 1.5 years, 2 years, and I'm like, what are you doing? Because Lupron puts you into temporary menopause because it shuts down all of your estrogen production in an attempt to shrink the fibroids. Lupron should only be used in a situation where you're trying to get the fibroids small enough to do surgery safely, or you want to help the woman to stop bleeding and get her body a chance to recover its blood supply after you've given the transfusion. It should not be used for 2 or 3 years. I've had a few clients come in, and I'm not sure why they were on Lupron for 2 or 3 years, but they were, and they really shouldn't have been because it will destroy your bones and other things. So anything like that, if anyone's using Lupron for fibroids, it should be used 6 months, 9 months at the absolute tops. because otherwise the side effects are way too detrimental and will cause you some really long-term lasting effects besides just hot flashes and night sweats and mood swings and all that other kind of stuff. So please don't be on that for a long period of time because it can be really, really dangerous. Okay. But again, with the hysterectomy, you can have, once the hysterectomy is gone, it's gone, but nothing really removes the fibroids unless you go in surgically and take them out. I don't care what the commercials say. The only thing that really, really gets rid of them in total is to physically remove them. Now, once you hit menopause and your hormones shift, I talked about menopause a couple of weeks ago, the fibroids will shrink. They will actually do what they call calcify. So instead of being soft like this potato, they're going to be like hard, like a marble. They kind of get really, really crunchy and hard. I've never bit one, but you get it right. So they will, and obviously you'll stop having periods at some point because you're in menopause. However, very large fibroids will shrink again, some, but if they're very bulky, you'll still have a good bit of bulk even postmenopausally. So again, they don't just go away once menopause kicks in. They just get significantly smaller, and obviously you're not bleeding anymore. So the bleeding goes away and you're not having some of those issues. But I have taken hysterectomies on women who were well into their 60s, and they still had uteruses that were about, the size of a 5-month pregnant person, because even though they were no longer bleeding, the fibroids didn't just leave on their own. So if you're close to menopause, and talking about menopause, that transitional phase, we talked about it before, where the hormones are kind of all over the place. When you have fibroids, that makes menopause really unpredictable because you never know when you're going to bleed. You never know when or how much or how hard you're going to be bleeding, and it's kind of like you're all over the place. And you can get into some real bleeding trouble. So I would encourage you, if you have fibroids or if you're kind of concerned about what you're going to do about them, and you're kind of worried about them, just seek treatment before you get to a point where you're like in an emergency situation and you're like in the ER because you done passed out somewhere on your period and now they got to take your blood and all this other stuff. And you have to think about stuff like in a hurry. I would suggest that you just try to make sure you're seeing your GYN and discussing the conversation with them, and decide what you're going to do when you don't have to do it like in a real hurry, when you don't have to do it and be all like, oh, I'm bleeding. Because sometimes it's amazing how women can bleed down to super, super low numbers of iron, and they're like, hemoglobin will be like 4 and 5, and you're still walking around breathing. It's just amazing. So all that being said, yay, we're just about out of time. And Allison says she has no uterus and no fibroids, and she is so excited about not having a uterus or her fibroids because she is. That's what it's about. But for those of you who still hold on to it, listen, don't wait till you start bleeding too bad to get rid of it. Figure out what it is sorry about that. Figure out what it is you want to do, and figure out what you want to do earlier than later. Ladies, remember this month, this is Heart Month, Heart Healthy Month for women, and Friday is Go Red Day for women, thinking about women and heart disease. So don't forget to wear your red on Friday. Don't forget to talk about think about your heart health. Oh, and you have your fibroids, get rid of them, because anemia causes a strain to your heart because you're bleeding too much. And then you're going to be having a problem anyway. So take care of yourself. It's like 9:30 and I am out of time. It is Talk About It Tuesday. I'll see you guys all next week. I'll be back. Oh, preview. It's Valentine's Day next week, y'all. So I got to be talking about, the STDs. Yeah. Tell your cousins and your youngins to get on, because we're talking about all of the S, the T's, and the D's. I might even have pictures. All right. Thanks, guys. Appreciate you. Love you guys. Talk to you later.